Hi, this is your Houston chiropractor, Dr. Gregory Johnston. We have Cindy back here with us today, the marathon runner, and she is midpoint through her treatment schedule this week. She's had 4 treatments as of last night, and this will be her 5th one this morning, and then we'll see her again this evening, and then again twice again tomorrow for her very difficult breathing problem and the hiatal hernia issues. And she also has an issue called fight or flight, which is a sympathetic nervous system disorder that causes a lot of stress and anxiety and palpitations. So I'm sure a lot of you have felt that yourselves. So let's take a look at you here in the mirror first, Cindy, and analyze your posture. Okay, let's have you flex your head forward and then backwards for me. It's much better range of motion already. Did that feel a little smoother to you? Yep. See, her head's not as far forward in her posture, so she doesn't have as much forward head posture. Her hands are more at her sides now. That's also very good. You're sleeping on your back more too, aren't you?
Yeah.
Yep.
That's hard.
Yeah, it is, but that's part of, see, when you participate though, things do better. That's a big thing that we do, is we try to get the patients participating in their own wellness and doing things right, like sitting correctly, sleeping correctly, standing correctly, breathing correctly, everything. Okay, now let's have you come over here, and I'm going to decompress you first. You know, and that's one thing I want to bring up about every single patient is breathing is a very, very important aspect of healing. And most people hold their breath when they're in pain, so they don't get good oxygenation, and they get that fight or flight feeling from that too. Their heart starts beating fast and they get anxiety. So I was into martial arts from the time I was 13 years old till I was 35 years old. And the biggest thing that I learned in martial arts was how to breathe properly. So any of you out there who are having pain and find yourself holding your breath, now see, her reflexes aren't that great right here before I do this. So there we go, good. I would recommend Taekwondo Chung Kwan, which is what I got my first black belt in. Yeah, I can get another one. I didn't get it. There it is. That one did it. Okie doke. Now watch this. See, that's better. She's still kicking. Alright. So, she's also had a atlas subluxation up here, which is what I just adjusted right there. Now I'm going to get down a little lower. There we go. Good job. You're relaxing better though too.
Yeah.
She knows I'm not going to tear her head off right now, so she's relaxing. Just want to say, for those of you who are flying into Houston from out of the state or out of the country, let's roll over here and you tell me now how to get sideways. There we go. You want to bring someone with you. Cindy brought her mother with her, and I showed her how to pull her stomach down and help her with her hiatal hernia when she gets back home. And we're going to help find her a good chiropractor out in Mesa, Arizona. So if any of you guys know of a good chiropractor in Mesa, Arizona, let me know. I used to know a really good one out there, Dr. Michelle Shire. But she's out in California now. Okie doke. Now, there we go. That's it. That's it. So I'm adjusting her sacroiliac joints and her sacrum right now, just to get her pelvic base stabilized and straight, because the spine works together as a unit, along with the hips and the legs and the knees and the ankles and the feet. The old thing about the ankle bone connected to the knee bone connected to the hip bone, that's all very true. The body works together, functioning as a whole. And that's one of the things that we do here at Advanced Chiropractic Relief is I take care of a person's whole body, as opposed to compartmentalizing things and only adjusting her low back or only adjusting her mid back or only adjusting her neck. you go. Yeah. We still got some right here. Okay. She's really tight right here where she had that injury, so I have been working on the paraspinal muscles with my elbows, right where she had that injury in the thoracolumbar region around T10 through T12. That's pretty tender still, huh? Especially right there on that left side, yeah. Keep breathing in through your nose. And when you breathe, you want to breathe in through your nose and out through your mouth with your tongue curled up to the roof of your mouth. And that's easier said than done whenever my elbow's sticking in your back, but this is one of those hurt so good things. I've been really working Cindy over hard because she's only going to be here for 4 days, and she's been suffering horribly with this for the last 6 months. So we're going to get as much done as we can possibly do in this short period of time. And she's been very cooperative and good sport about it all. Yeah. Okay. There. And I'm going to use the Terminator on her because we really need to get down deep into these tissues. When you're hurt, because you remember to breathe through your nose. It's also hard for me to talk and you guys hear anything except the Terminator when I'm using that too, so I'm refraining my prime information for the softer sounding stuff. So now we're just going to improve her circulation into these tissues so that we can improve her circulatory system and blood flow that helps bring oxygen and nutrition into the cells. And it also helps the vasculature carry out the metabolic waste products of normal cellular metabolism. And you notice in this area I'm kind of doing what's called transverse friction. The paraspinal muscles run parallel with the spine up and down. So I'm running straight across those and working the fibers. Especially right through here. Because also through here we get what's called a somatovisceral reflex, which when you stimulate the muscle that's connected directly to the organ that the person's having problems with, it actually stimulates that organ to function at a higher level as well. In fact, when I got my elbow very deep in there, you probably feel that way down your gut, don't you? Yeah. It probably feels like it's sticking out her gut. Yeah. I've got some pretty deep, sharp elbows. I get a lot of volunteers from patients wanting to do that on me after I do it, and also wanting to pull me. Yeah. Well, I've had Renee walking and jumping up and down on my back before. She's not heavy enough to move anything. So. But those sharp elbows hurt no matter who they're on. But see, she's able to breathe a little calmer whenever I'm doing this one because it's not causing her to hold her breath as much. But that's one of the things I want to encourage anybody who out there is having acute or chronic pain. Acute pain's pain of short duration, just started from an accident or injury. Chronic pain is something that goes on of a duration past 3 months and lasts for a long period of time. Chronic does not mean you're going to die, it just means how long you've had the problem. The more chronic your problem is, though, the longer it takes to fix. And depending on how acute your problem is, if you've had severe acute soft tissue tearing, which is muscles and ligaments, that will take anywhere between 8 weeks and 12 months to actually get those soft tissues to remodel and heal up properly, and that's James Syriac. He's an orthopedic surgeon. Back in the 50s, wrote that. Any of you who've taken Dr. Dan Murphy's seminars, chiropractors that watch this also will recognize Dr. Dan Murphy's work. He and I are good friends. We used to do seminars all over the country together back in the late 80s and early 90s. Philadelphia and Miami and Atlanta, LA, Las Vegas, Portland. I think we even had one in Scottsdale for a year. That was for chiropractic certification in spinal trauma. It was an extensive 120-hour postgraduate education course within a 12-month time frame. So we were traveling every weekend, 3 weekends a month, to do our seminars. About the only month we took off was December and Thanksgiving. Now Cindy's been a marathon runner for quite some time. She qualified for the Boston Marathon this year, so we're trying to get her back in shape so she can actually go run that marathon this year. And if she keeps this up when she gets back to Phoenix and comes back to see me once or twice even before that, she's going to be able to run the Boston Marathon this year. That was easier, wasn't it?
Yeah.
Yeah. Okay, now let's go ahead and turn you on your back for me. Actually, turn on your side for me and face right towards me. Now I'm going to do a procedure that you guys don't see me do very often. And it's not a lumbar roll, but I'm going to contact her lower thoracic vertebrae and the ribs right here. And I'm going to pull those around just like that. Well, that moved better today, didn't it? Yep. Okay, let's turn this way. Yeah, that wasn't near as tight as it was last night. Good job. Okay, let's get your hip out this way. And let me get that right there. Good. And again, I take my fingers and hook them around the T11, T12 transverse processes. There we go. There it was. Okay, now let's turn you on your back. That one moved too. It wasn't as loud as the other side, but it moved. So now I'm going to adjust her ankles, which she'll feel all the way up into her hips and low back. Did you? Mm-hmm. No, not that one. There we go. Better. Okay, so I'm also going to just make sure her pelvis is level, which it is. Perfect. It's even too. Now, I'm going to pull you down here, Cindy, and we're going to adjust your ribs. There we go. Okay, now let's pull like that. Okay, I'm going to adjust her acromioclavicular joints out here on the shoulders. The sternoclavicular joint, which is where the sternum and the clavicle meet right here on both sides. And now I'm adjusting her costosternal joints right where the rib cage attaches to the sternum on both sides. Now she's had a lot more pain in this left side of the rib cage underneath here and restriction feeling. So we've been doing some intercostal work on the muscles right here. You can see between the ribs right there. Most people couldn't even stand this because they're so ticklish, but that's sore, isn't it?
Yeah.
Because the muscles, they run this way, so I'm doing again a transverse across them. I didn't put any email on there today, so it's probably a little more abrasive than it was yesterday, but your ribs aren't sticking out as much as they have been, so that's a good sign. Now the lower rib cage is made up of cartilage, so you got to be careful down here, because you can tear that cartilage if you do it the wrong way. If you're not a chiropractor, you should not be doing this at all. Don't just be trying this on your kids at home. Deep breath in for me. There you go. Atta girl. And just keep exhaling now. And right now I'm grabbing her top of her stomach and I'm pulling it straight down through the diaphragm, which is not even up there that much today, so that's good. She hasn't had any hiatal hernia symptoms last night and today. She's mostly having restriction in breathing and that fight or flight stress / anxiety, which comes from interfering with the nerves that come out of the T1 through L3 vertebrae that connect through the sympathetic chain all the way up and down. And that controls the vasoconstriction. If you got too much sympathetic nervous system activity, it causes vasoconstriction. It also causes bronchial constriction too, so that's why people get asthma that can be helped by chiropractic much better. Good. Okay, let's sit you up and face toward Renee. Okay. Now you got another relative coming in today, right?
Yep, my mother-in-law.
Yeah.
Was able to come.
Good. Is she here yet, or?
No, she flies in at 11:30.
Oh, okay. It didn't take you long to get over here from the airport either, did it? About 15 minutes to get to the hotel?
Yeah, it was fast.
They got shuttles going to the Hyatt Regency from George Bush Intercontinental, which is IAH call symbols. Good, okay. And we also have all that information on our website, advancedchiropractor.com. If you go to the About Dr. Johnson section and hold the cursor over it, it'll say About Houston. So it gives you hotels in and around where we are, as well as things to do in Houston, like the Galleria and NASA. Okay, let's go in here and put them here now. Okay. So we are going to adjust her atlas on the x-axis in a mirror image. Okay, let me just first flex forward and backwards. You okay? Yep. Take a look at that, my dear. No, look in the mirror.
Look up.
Yeah, take a look. See? Your shoulders are level. Oh, you can't see that. Sorry about that.
It's okay.
Okay.
Oh, yeah.
Yeah, you're right in the center. And this is also right in the center, too. Your pelvis and mid-thoracics are better. But we're still going to have her pull her shoulders up and back with her traps and her rhomboids. We're going to bring her head straight back in the Z-axis and then rotate it upwards on the X-axis. We're going to adjust her atlas on the X-axis, which will send a barrage of neurological information into the hindbrain or cerebellum. You can relax now. Okay, let's have you go forward and backwards again. That should have felt smoother.
Yeah.
Good. Good, good, good. So if you see now, see her hands are at her sides, her head's up and back over where it's supposed to be, her shoulders are squared off. Would you mind sharing with our YouTube subscribers, Cindy? This is midway for you.
Mm-hmm.
How are you feeling today versus when I saw you first thing Monday?
I'm feeling a lot better. I came in, I was really panicky. I feel like I was kind of not hyperventilating, but I was gasping for air. And now I'm starting to retrain my mind to breathe with my belly.
Breathe through your nose in and out through your mouth and deep down in your core. So we're not just adjusting her spine and taking care of her musculoskeletal system, but we're trying to teach her daily life activities that will help her improve her breathing capabilities as well as her posture and just all kinds of things like that. Martial arts training, everything. And also scriptural and spiritual advice and
kind of letting that fear go.
Let go of the fear. That's right. Fear is not good and it will hold you back. So we also pray for her, lay our hands on and pray for her healing, and we do that for all of our patients, by the way. Some people out there don't like that we're Christians, but I don't care. I work for God, so so Sarah's halfway through, and we're going to do another one, or not Sarah, I don't mean to tell your mom. Cindy's halfway through, and we're going to do another video on her Thursday afternoon, and this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.